Thanks, Katie. Hi, everybody. Thank you so much for joining us today. It's great to be here with you all. As Katie said, I'm Kate Gleason Bachman. I work with the National Healthcare for the Homeless Council, and I'm really pleased to be with you all today to talk about health management. Um, I think my bio was shared, but I'll just say I'm a registered nurse, and I have worked in healthcare for the homeless since 2010, and I work in Philadelphia. This is where I've always worked as a nurse, and I have worked across several different healthcare for the homeless settings. So I've worked in the shelter system, I've done outreach in street medicine. I have worked in a federally qualified health center that was an HCH setting, and I've also worked in permanent supportive housing. And I currently work at the National Healthcare for the Homeless Council 4 days a week and 1 day a week. I still have a clinical practice. I work in one of our HCH health centers. Here in Philly, we have a clinic that's in our transit system that a lot of people stay in. It's a multi-service center hub, and part of what we do there is primary care. So I work as a nurse there on Fridays. So I'm really happy to be with you all. This is a topic that is an interesting one to talk about because in a lot of ways it's kind of second nature. We'll talk about exactly what it is, but it's kind of everything in some ways. And so it's interesting to kind of start to think about kind of all of these things that we do around health management in a different way and to think about how we can kind of support people who we work with to improve their health management skills and kind of thinking about this as something that is not static, but is actually um, really able to be taught and changed. And there's a lot of things we can do to help people with health management. So it's a topic that I really like talking about. A lot of this work was developed by myself and then a colleague of mine who is an occupational therapist. And occupational therapists are such great resources, I think, for health management. So this is a topic that we really enjoy talking about. So I appreciate all of you being here. As Katie said, if you have questions, feel free to put them in the chat. I'll try to pay attention to it. And I think Katie will be looking at it too, and we'll have some time for questions at the end. So just a quick review of our objectives for this session. I'm hopeful that by the end, you all will be able to define what health management is and explain why this is an important concept. Understand how experiences of homelessness and other significant challenges can impact health management, and then gain some strategies for how to assess and then address or help people with their health management needs. So the first thing I want to do is kind of define health management and think a little bit about what this is. So health management is any activities related to developing, managing, and maintaining health and wellness routines, including self-management. And so the way I kind of explain this is these are all of the things that all of us do to maintain and manage our health kind of outside of immediate care settings. So outside of the provider office, like outside of having some type of medical visit, this is kind of everything else that you do to help manage your health. And sometimes I think it's helpful to think about what some activities might be to kind of think through what this really is. So symptom and condition management. So things people do like to manage their asthma symptoms, to manage diabetes, communicating with the healthcare system, things like making appointments, refilling prescriptions, explaining to a healthcare provider why someone has come into the office that day, medication management, all the things related to managing medications, including taking them in the correct way on time, being able to get refills when they're needed. Physical activity. This can be related to mobility, but also could just be physical activity like getting exercise or having an exercise plan or routine. Nutrition management, preparing food, purchasing food, having a plan to manage a diet if you need a special diet based on healthcare needs. Personal care device management or using durable medical equipment. This is things like using a nebulizer, using a CPAP machine, using an insulin pen, using a glucometer, any kind of devices that we use to assist us with our health, even using a cane or a wheelchair. And then social and emotional health promotion and maintenance. This is kind of a large umbrella for like self-care activities, being able to regulate oneself, emotional wellness. So all the things that kind of fall under that umbrella. So this is a big, big list of things. And I think if there's one thing that I would love for folks to take away from this session today is just to understand and kind of think about this in a little bit I hope in a little bit of a different way. A lot of these type of things, as we encounter patients, they can come across as something that's pretty static, like this person misses all their specialty appointments. This person has a really hard time managing their meds. This person, is not managing their diabetes well, whatever the person might be struggling with, is to kind of shift into thinking about these things as something that we can actually assess to find out kind of where are this person's strengths and where are their areas that they need help with those specific things. Why are they specifically struggling in those areas? And then to think through a plan for how to help them, either through adaptive strategies, which we'll talk about, or through teaching. So to teach people new skills. So to kind of think about all these pieces that we encounter as we're talking with people and hearing about kind of what they're struggling with or seeing that they're struggling with things, that these are things that can be broken down into pieces that we can then support people with. And so this is like a changeable thing that we can really make a difference for people. And sometimes, we're already doing that in a lot of areas, but it helps to kind of think about it in a kind of holistic way. Like these are changeable things that we can really support people with. So that's what I'm hoping we get out of this. To step back a little bit, I'm just going to give some background about why health management can be challenging for people who are experiencing homelessness or housing instability. And then we'll go specifically into talking about how to assess and then address health management. So some of this will be review for folks, but I think it's worthwhile to mention anyway. We see Maslow's hierarchy of needs here, with physical and safety needs at the bottom, being the kind of basis of everything else that we're then able to do. And so we know that for people who are experiencing homelessness or housing instability, if they are trying to focus on meeting their basic physical and safety needs, it's very, very hard to then work on health management. So if people's basic needs are not being met, to then try to think about how to manage their diabetes or get to appointments really becomes secondary to kind of staying alive and meeting those basic needs. So that can make some of these more complex health management tasks in particular very difficult for people. Thinking a little bit specifically about how experiences of homelessness may impact health management. We talked just now about meeting basic needs. So for people who are thinking about their next meal, thinking about where they're going to sleep, thinking about safety, it's very, very difficult to kind of move beyond those things to think about getting to appointments or when meds need to be refilled, or being able to address something health related until it becomes emergent. Self-assessment and decision-making can also be challenging for people who are undergoing a lot of stress, who may be undergoing trauma or have a history of trauma. It can be very hard to kind of assess oneself if someone is in an emergency situation related to their health or not. What actions are appropriate to take, and kind of making decisions around health can be really impacted by constant stress and experiences of trauma. Stigma and healthcare provider bias we know can play into this, and that can often be contributing factors to people delaying care or not seeking care. And so some things that perhaps could have been addressed sooner are not. And that can make it much harder, obviously, as things escalate to manage healthcare. Time management and appointments we know can be difficult for folks who are experiencing homelessness. They may not have consistent access to a phone. They may not have consistent access to calendars or reminders. They may not be getting appointment reminders, and may have a very difficult time also with public transportation or mobility, so getting to appointments. Medication management can be difficult for folks who are having to perhaps carry all their medications with them, or who are staying in a shelter that they need to leave during the day, but their medications may be staying there in place, and so they're not able to take their daytime medications in the way that they would like to. Meds obviously can be lost, can be stolen, just can be very difficult to manage medications, especially when they're dosed multiple times a day. Similarly, if people don't have access to refrigeration, it can be very hard to manage some meds that are refrigerated. And then the use of durable medical equipment, very similarly, if these are things that need to be stored in the refrigerator, if things need to be plugged in, it can be very difficult. And then for folks who are using something like a cane or a wheelchair, if they're largely staying outside, that equipment tends to get a lot more wear and tear than would be typical. And so it can be really hard for people then with damaged a wheelchair or damaged cane to get to where they need to go to use them. And as we know, insurance only covers those things typically every 5 years. I think for a cane, it's annual. But if people are going through things quickly with a lot of wear and tear, it can really be challenging. So I'm sure you can think of many other examples of how this can be difficult for people who are experiencing homelessness. But when you're kind of struggling to meet these basic needs, it's hard to do more complex health tasks. Let me pause there and see if folks have any questions, and then we'll go to talk a little bit deeper about health management.
I don't see anything in the chat, but
Okay.
feel free to pop mute too if you have any questions.
Yeah, that's fine. Okay to jump in. It's a small group, so that's totally fine. So when we think about health management, we break it down into three main components. The first is assessment. Assessment can be both individual and organizational. So what we've been talking about so far is individual assessment. Like how do we assess the needs of an individual client who we are working with? We can also step back and think about our organizations and how organizationally we can set up or better set up to address health management. So this would be things like looking at the intake process. How are people kind of understanding, or how is it being explained to them? How to interact with their care team, how to seek help if they need it. Do they understand kind of the process of the health center? When people come in, how is a med reconciliation or medication reconciliation built into the process? How is patient education built into the process? So we can kind of think about from an organizational standpoint, how are we kind of addressing for every single person these health management skills so that when someone is leaving an appointment, they have their referrals in hand and all the referrals say the reason that they're being referred and have their medication list on it. Those types of changes organizationally can really set people up to have success with their health management, or for it to be easier for them to manage all these tasks. And we'll talk a little more specifically about that. And then individually, we're just looking at the client and thinking about for them, what are their goals, what are their needs, and how can we kind of figure out how to support them. Once we have that figured out, we move on to both adaptive strategies and education and skill building. And these are two things that can happen at the same time. They don't necessarily have to happen in this order. So adaptive strategies are tools or strategies that we can give to people immediately that help them compensate for any kind of challenges that they have, for any deficits, for skill areas where they need help. A great example of an adaptive strategy is a weekly pill box. So that's something that immediately helps someone to physically organize their medications and to know like whether they've taken them that day or not. And then what can happen at the same time as giving someone adaptive strategies is doing education and skill building. This takes a little bit more time. So this is helping someone develop new skills, practicing techniques. Like, for example, we might be filling the pill box for somebody at first. And while we are doing that for them on a weekly basis, each week we're also working with them to develop skills so that they can learn to fill it themselves. And so they're kind of doing those two things at the same time. So this is just a way of kind of thinking about health management. And as we start this assessment process, kind of how do we break down how to do this? So thinking about how health management abilities or barriers could be influencing people's health outcomes in the short or the long term. So thinking about like why someone is having difficulty taking their medications. So we might be noticing that they're not taking their medications. Or we're wondering if they're not taking their medications because we're not seeing the changes that we would anticipate if they were. And so how can we kind of dig in and drill down with this person to find out what is the reason that they're having difficulty with this? Are they losing their meds? Are they having difficulty opening the pill bottles? Can they not see the bottle? So there are all these kind of reasons that if we begin to question and talk with someone, we can find out. And for all of those, there is an intervention that we can put in place. We can get the easy open pill bottles. We can make sure that large print is on the pills. We can put them into a large pill box for people if that's a challenge. So kind of getting the information from someone so that we know how to help them. Similarly, why is someone missing so many specialist appointments? Maybe it's that they're scared to go to the specialist, but perhaps it's because they're having trouble getting there on public transit, because they're having trouble keeping track of the appointments, because they have some cognitive challenges around reading their calendar. And so they need a different way to get reminders or to know that their appointment is coming up. And then we talked about this a little bit, like why is the medication or intervention not having the anticipated effect? An example I often bring up around this is for someone who's taking insulin. Years ago, I had a patient who they were receiving insulin and they were having no change in their blood sugar. And the insulin, the provider was increasing the insulin every time they came in, and we were seeing no effect. And finally, we had them come in with their insulin pen and show us how they were taking it. And they were removing the first cap off the insulin pen, but not the second one. And so they thought they were administering their insulin every day, but they actually were not getting any because they weren't removing the second cap. And by observing them doing the medication self-administration, we were able to see that that was happening and teach them how to do it differently. So these are just ways that we can kind of dig in a little bit more to finding out what's going on with someone. So the assessment, this is a process, it's systematic, we're collecting information, and that information can be used by our clients, by clinicians, and by the whole team to identify and support kind of how we can intervene with folks and help them to improve their health management skills. So we're going to ask questions to try to understand the person's situation, to try to really understand what's happening. We want to identify strengths and existing skills that the person has, which everyone, of course, does. People are doing well in some areas and they may need support in other areas. And then identifying resources and supports that the person needs and thinking through what's the best way to help them. We typically break health assessment, health management down into these 6 categories. This is what we have created. And at the end, I'll share some links. We have a toolkit around assessment and also a toolkit around adaptive strategies and skill building. And I'll put links to those in the chat so that you all can use them if you want to do a deeper dive. But in those tools, we have these kind of 6 categories. And I'm sure, we can think of others, but this is largely capturing most things. So health literacy, people's ability to understand instructions and read and understand numeracy as well. So understanding like number of times a day they're supposed to be taking something or even like time. Medication self-management, physical skills for health management. These are things like using an inhaler or self-administering insulin, time management, self-advocacy. This is being able to share with people in healthcare settings why you've come in, what you're experiencing, what your needs are, what your health goals are. And that can be really difficult for folks, especially if they've experienced discrimination or stigma in the healthcare system. And then self-assessment and decision making. This is the ability to kind of understand what's expected based on your current health journey or medications that you're taking, to recognize if something is out of the ordinary or something is wrong, to be able to assess if it's an emergency or not and what the correct course of action is, and making decisions around those things. And also decision making around healthcare needs. So if someone has a new diagnosis and they need to choose a treatment path, that is health decision making, and that can be a very challenging skill for folks. So we started to talk a little bit about health management and how to discuss and find out from the client what's going on. Excuse me, sorry, I've been sick recently, so I still have a little bit of a cough. So this is really just about talking with the person, finding out from them what's going on, but in subsequent slides, we'll talk a little bit too about observing. So I mentioned watching the person self-administer insulin. A piece of this is also kind of seeing how the person does something. So for this, we use motivational interviewing. So really, without going deep into motivational interviewing, which you may already be familiar with, we want to ask the person questions that elicit answers that are not just yes, no answers, that are open-ended questions. So it's much different to say to somebody when they come in, like, how are you doing with your insulin? And the person just says good, or they say, okay. That does not tell us a lot about what's actually happening with their insulin. And a lot of times people don't want to say that they're having a struggle. So when they have a way to just kind of say it's fine, they do. Um, but if we say to them, can you tell me about, how you're managing your diabetes? Can you walk me through your day? Tell me about checking your blood sugar and when you check it and then what you do. We can find out a lot more information than just saying like, how's this going? So we want to ask people questions that elicit responses that we learn more from. So I often say like, can you tell me about how you take your medications? If possible, I want the person to show me what they do. So if they can bring in their medications or they can show me how they're filling their pill box, it tells me a lot of information about what's going on. We want to learn about that person's perceptions of their health. How do they feel that they're doing? What are their health goals? Sometimes people's health goals are quite different than what we might assume they are or what we think they should be. And so it's very, very helpful for us to understand what that person's goals are. And that can tell us a lot about why they might be prioritizing one thing over another. That to us doesn't necessarily make sense, but as we start to talk with them, we learn why this is important to them. Any concerns they have about health management, so any struggles that they have self-identified that are difficult areas for them. Current health knowledge, what they know and understand about their current health situation. And I find also when we start to ask questions of people that are open-ended about what they understand about their health, we can learn a lot. And a lot of people have misconceptions because over years they have picked different things up or different people have said things to them. And so there's a lot to be done around just education and helping someone understand um, what it is that's happening with them. And that gives people a lot of power back when they can often feel very disempowered in the healthcare system related to managing their health. These are ways that we can help people feel more in control again. What they're currently doing to manage their health. And then we can use standardized questionnaires. I'm not going to go deep into using those questionnaires, but if you access the toolkits when I give you the links to them, we have a whole kind of list of all of different assessment tools that you can use with people to like assess health literacy, assess self-advocacy skills. So there are some tools out there that are standardized that you can use to help assess kind of what's going on with someone. I mentioned observation as well. So watching someone do something can tell us so much about how it's going for them, and can really help us know the areas that they need support. And then their environment is another big piece. If you're able to observe someone in their environment, it tells us a huge amount more. We're not always able to do that. Many times we're seeing someone in a clinical setting, um, or even in street med, but we're not like where they always stay. But if you can see someone, like for example, in the shelter where they're staying, and you can watch how they set up their CPAP machine where they are staying, you can learn so much more about what's happening for them. Okay, I'm going to pause there before we get into the adaptive strategies portion, just to see if there's any questions.
I don't see any questions in the chat quite yet.
Okay. All right, so moving on to adaptive strategies. So adaptive strategies focus on minimizing or mitigating barriers to health management. They change the environment, they may change components of the activity, or they provide tools or devices to compensate for areas of difficulty, impairments, or lack of skills. So adaptive strategies are great because they can be used immediately. They can very quickly help someone be able to manage a task, or decrease risk or safety concerns. So we talked about using a weekly pill box or even getting blister packs from the pharmacy, the ones that have like the little bubble packs where the person can just pop out all the pills that they need for the morning or the afternoon. Another good example of an adaptive strategy that can help immediately for people who are struggling with inhalers, to use a spacer device. So that can very quickly help someone to be able to take their inhaler much more effectively by just putting the spacer on there and showing them how to use it. We can apply adaptive strategies across all different health management domains, and I'm going to give you some examples. But these can be done immediately, and they can be done while we're teaching the person skills as well. But these are things that can happen right away to support. So some examples of adaptive strategies. For health literacy, so providing materials in low literacy formats. If there are vision challenges, providing things in large print formats so that people can see, obviously providing in the language that is most appropriate for the person or their preferred language. We've talked a lot about weekly pillboxes for medication self-management. Other adaptive strategies here could be trying to simplify a medication routine regimen for someone. So if someone has a very complex regimen, if there is a way to change to make it more simple, like if we find that I have a lot of patients who I work with who, for whatever reason, they either only take their pills in the day or they only take their pills at night. They often do not take their pills twice a day. And so we frequently work with people to see, can we move at least most of their meds to one or the other times when they're usually taking them, just to try to make sure that they get the most of their medications every day. And that can really work well for people. Physical skills. So this would be pill bottles that can be made easy open, using a weekly pill box that is big enough for the person to manipulate with their hands if they have the dexterity to be able to do it. Sometimes the smaller ones are very hard for people to use. Time management, so helping someone with a calendar, using phone call reminders if people have a hard time using a calendar. So just calling them or texting them to tell them when their appointment is coming up. For self-advocacy, I mentioned for referrals, if we have excuse me, a policy in our organization to make sure that every referral has the reason for visit on it. That doesn't just say evaluate and treat, but says, the person's being sent to cardiology to evaluate ongoing high blood pressure that has not responded to current interventions. So that way, when the person, they may be waiting many, many months to see a specialist, and we don't want them to get there and it's months later and they don't remember why they're there, and there's no way for the specialists to know either, and so then it's kind of like a lost appointment. But if it's written on the referral and if their medication list is there too, then the specialist has the information that they need to at least get started. Self-assessment and decision making. An easy adaptive strategy here is making sure that everyone has the information available on how to contact their healthcare team, so that if they are in a difficult decision-making moment, they're not sure if they need to go to the emergency room or come into the clinic, they can call and get some support with that decision. Let me pause there. That was a quick rundown of adaptive strategies to see if folks have any questions. Gives me a chance to drink water too, because I don't want to be coughing. Okay, so we'll talk a little bit then about education and skill building. So this can be a more long-term process. Skill building and education takes time. It's not something, although people may learn something certainly in a single session, and it may be that we observe that someone is doing something incorrectly and we're able to just correct that thing, and the person may do a great job remembering that and they change that moving forward. And so in that case, we might check in with them to make sure it's going okay still and observe them again. But that can be kind of a quick skill building change. But for a lot of things, it's going to take time for the person to kind of learn. For example, if we have someone who has a really hard time with self-advocacy or communication around their healthcare needs, and they may have like a community health worker or a peer or a nurse coming with them to their appointments initially, that is a skill building time and a way to model for them kind of how to manage an appointment. Some people have had such kind of tough experiences in healthcare, or they really haven't accessed healthcare since they were a child in many cases, because they have really been hesitant to do so. It can be very challenging to know even how to go and check in, to write your name down, to wait for them to call you, to give them your, ID card. If you have no ID, how do you navigate that and kind of get through that process? And then how do you ask questions of the provider, which can be very hard for people. And so sometimes folks may have someone coming with them for several appointments, and that person is essentially like modeling to them how to do this process. And as people go with someone else, they begin to take on more and more. And that's a very natural process that people begin to kind of do more for themselves as they're learning and seeing how to do this. So that would take place over several visits. So a lot of these things happen over time. The same would be the case for helping someone learn how to fill a pill box. They might begin with just filling it for one medication that's dosed once a day, and we see how they do with their dexterity. Like, are they able to pick up one pill at a time and get one pill successfully into each um, box? Are they able to then see if they have a pill in there to confirm that it's in there or not? Um, and then the next time they might start doing one that is dosed twice a day. And eventually they get to the point where they can fill the box completely on their own, but it can take time. And a lot of that depends on the individual person, and kind of what their learning needs are and their abilities. So in general, when we're doing this skill building, I just want to recognize that it can take time. We want to use an organized approach to help the person gain skills. Another thing that often happens when people come in to services, especially if they're new to services and there's a lot of things happening with their health that's complex, we as the care team might see, like 15 things that we want to address with the person, and we cannot address them all at once. And so another piece of this organized approach is to kind of pick one thing. And it really helps for it to be something that the person feels self-motivated about. And that's why we want to have these conversations about what the person wants to do for their health. Like, what's the most important thing to them, or what's the area where they are feeling the most challenged, and then to start there. But we want to kind of pick one thing at a time. We want the person to have multiple opportunities to practice with decreasing levels of support. So that's what I talked about in terms of like filling the pill box. They start with just one piece of it and they kind of gain from there. Um, Sometimes as we're teaching someone, we will kind of talk them through every single step. And then eventually we move to having them talk us through every single step. So as they get more comfortable with it, we begin to not say as much and have them explain to us like what they're doing and what they're going to do next. That's something I often do when I'm teaching people how to self-administer insulin. At first, I do it for them and I talk them through every single thing that I'm doing. And then I begin to tell them kind of what the steps are, but they are physically doing it themselves. And finally, they do it completely themselves while they're telling me what they're doing. We want to create a learning plan that's specific to the person's needs. I mentioned this already in terms of, different people have different abilities and interests in doing this. So some people might want to kind of do it all, and we need to hold them back a little bit and think about like, let's pick one thing to start with. For other people, it can feel really overwhelming and they really want to just focus on one thing and completely master that before moving on to something else. Typically, we only want to teach 2 to 3 steps at a time and not more. And as I mentioned before, we can do skill building and adaptive strategies at the same time. So we can introduce a pillbox as a quick adaptive strategy to support, while we're also kind of over multiple visits teaching the person to fill it themselves. Here are some more examples of skill building. So for health literacy, we could educate people on common medical terms or diagnoses that are relevant to them, that they might be hearing in medical visits, so that they have a better understanding of what's being said to them and kind of what their medical situation is. Sometimes people come out of a specialty visit or even a primary care visit and they really don't understand what happened. Sometimes it can be great for someone to check in with someone if they have historically had challenges with this after they meet with the provider, to just check in and say like, hey, what is your understanding of the visit? What are the next things that you need to do? When are you supposed to be coming back? And we can assess in that way what the person got out of the visit and where they might need support. And over time, we can teach them more and more about kind of what all those things mean, and they'll have more understanding. Medication self-management. Errorless learning, I bolded here because this is a strategy. This is explained a lot more in the toolkit, but errorless learning is when you teach someone to go through a process and you kind of correct any mistakes that they're making in the moment. So you kind of help them go through the process. Anything that's not happening correctly, you say, okay, I see you doing this, but what we want to do is this. You got 2 pills in this one box. We want to make sure that there's only one, or you forgot to take the second cap off the insulin. And so I want to pause and have you do that and we kind of cue them through. The reason to do errorless learning rather than just observing someone and allowing them to make an error is sometimes people learn the error, because that's the first way that they did it, they tend to continue doing it that way. So by doing errorless learning, we kind of intervene in the moment to make sure that the first time they experience this, they're doing it the correct way. Physical skills for health management. So an example of this would be hand over hand assistance to guide the person to feel what it feels like and the right amount of clicks and seeing what it looks like on their insulin pen to get the dosing correct or finding the injection site. So hand over hand is another strategy where you actually put your hands with the person's permission over their hands so that they can feel what it feels like. And this can make a big difference for people just so they feel like what it feels like to put the right pressure on something or what it feels like to um, do the clicks on an insulin pen or what it feels like to put the spacer on their inhaler. So hand over hand can really help people. Time management, an example of this would be teaching the person how to use the calendar on their phone. That, as I'm sure you know, can be very, very challenging for folks. I know even just teaching my people in my family how to do that is very difficult. And so step by step, we can teach people how to put something in their calendar and make sure there's an alert so that they get alerted in the time frame that would be helpful to them. Self-advocacy, this would be helping someone to practice statements or practicing assertive communication skills to use in healthcare visits. This could be role play. This could be sitting down with the person before an appointment and thinking through with them what are the questions that they have for the provider or the specialist so that they can go in with a written list of things and they learn over time and practice how to kind of speak up and ask those questions. Self-assessment and decision making, skill building here might look like practicing decision making scenarios. So kind of coming up with some possible scenarios and helping the person learn how to think through and review what potential decisions could be and what the outcomes might be. So in terms of creating a holistic understanding from all these pieces, assessment, adaptive strategies, and education and skill building, we want to think holistically, as I said, this is a huge umbrella of things. This encompasses like almost everything that people do outside of provider visits in the healthcare setting. So we want to break it down, but also kind of be holistic in thinking about what's happening for this person overall. What are their strengths? What are the barriers that they're facing? What are the supports that are needed? Um, Thinking about, just going to put all these on here. What can we do to help this person based on their goals for themselves? What are the things they want to prioritize? Thinking about, do we need to adjust medication or dosing schedules to make it easier for the person? Referrals for further evaluation. Occupational therapy is always a great referral if it's possible to help the person kind of have more support, especially with these physical tasks, or to have someone be able to observe and support them in the environment where they are living or where these things are happening. Connecting people to community supports, making sure people have access to durable medical equipment if they need it. Addressing sensory impairments. So I made reference to this a few times, but sometimes people have visual challenges that are making it very difficult for them to manage certain health tasks. And so getting them to a vision appointment, getting them the right prescription, making sure we address these things that are happening makes a big difference. Education and teaching, and then adjusting the frequency of follow-up visits. If it's possible, sometimes in the beginning, we want people to come in very frequently. And what I find is people don't continue typically coming in that frequently. Sometimes there could be some hesitancy because we don't want to become too busy in the clinic by like having everyone come in every single week. But usually I find if we are able to kind of front load some visits for someone and do a lot of teaching and help them set up or go with them to several appointments in the beginning, people naturally kind of step into their own independence and are able to do a lot more on their own. And it really makes a difference to kind of front load all of that teaching. So we just have two case examples to quickly chat about, and then I think we have um, time for questions. I'll pause there and see if there's any questions that people have right now. Okay, I'm going to go through these two examples. The assessment and the adaptive and skill building interventions are all here. It's just kind of an example to kind of see what this might look like, especially in a complex situation, which is typically, what we're seeing. People are complex. Everybody has a lot of different things going on when we start to really think about um, their kind of holistic health situation. So in this case example, this is a 58-year-old cisgendered white male coming into primary care after toe amputations related to frostbite. So this person, in terms of their assessment, this is their first time coming into primary care in 15 years. They have been unsheltered, um, and so they're not used to being in a healthcare setting at all. They came from the hospital and referred to primary care. While they were in the hospital, it was identified that they have a chronic heart condition. They perhaps have been uh, accessing the emergency room, and so they've had a lot of different med doses. It has been very inconsistent. They have limited knowledge of medication management, so have had a tough time kind of taking those meds or even knowing what they're supposed to be taking. And they have had memory challenges related to ongoing alcohol use. So this person has a lot going on. Um, and so we, in this case, would work with the person to kind of think through what are the most pressing things that are happening for them now. If they have a recent amputation, it's probably going to be making sure they know how to care for that. If they have new meds, it's going to be making sure that they have a med regimen that they understand, that is simple, and that they're going to be able to use moving forward. So in terms of adaptive and skill building interventions for general health management, we might work with the person to figure out like how to refill prescriptions. Do they know how to do that? How do they want to do that? Do they have a pharmacy that they have used? Do they know or understand how to schedule appointments, and can we support them with that? And a lot of times in the beginning, people do need support with that. Sometimes we actually have meds get delivered to our clinic and people pick up their prescriptions from the clinic. We have a pharmacy that we work with. And so that is an easier way for them to begin to manage their meds on their own, is to come to the clinic for their meds because they're already coming, rather than having to go to a second place. Using a pill box to help organize medications and support recall. So if this is a person with memory challenges, the other nice thing about a pill box is people can, if they know the day, which can be a challenge as well, but if we can teach them how to learn what day and date it is, they can then look and see, like, did I take my morning medications or not? And they can look at their pill box and see. And that really helps people who cannot remember, like, did I take my evening medications or not? The pill box allows you to look and say, oh, they're still in there for Tuesday, so that means I still need to take them. For this particular person, we started a notebook to monitor symptoms and record questions that the person had for their providers, and then also worked on self-advocacy skills and engaging with providers, using a harm reduction approach, which we haven't gone deep into, but that's basically just making sure that um, we're kind of meeting the person where they are in terms of understanding what their goals are for their health and where they are seeing challenges. So there's a lot more we could do with this person, but in terms of those kind of beginning places, we're trying to make sure they get their medications. And in this person's case, if they still have a wound, making sure they know how to care for it. For the second case example, this is a person, 61 years old, a cisgender Black male, discharged from a hospitalization with a diabetic foot wound and coming to a medical respite setting. So for this person, they came in after assessment with a pretty limited understanding of how their diabetes was related to the diabetic foot wound that they had. Their diabetes was quite out of control. They had not previously used insulin. Um, they had a very hard time storing and accessing their medications while they were staying in shelter, and had a hard time managing their diet in shelter too, just because they didn't have a lot of control over the meals. So in terms of adaptive and skill building interventions, we did a lot of teaching for this person around diabetes and dietary basics and how to use insulin. And very important for this person was, this was a case that was a patient of mine, but um, to understand that the wound on his foot, which was very distressing to him, was related to his diabetes. And because of that, by controlling his sugar, he could also help the healing of this wound. And that was actually very empowering to him to understand that relationship. And it made him a lot more motivated around taking his insulin and managing his diabetes. So we taught him about how to manage the wound, um, how to take his meds. And he actually began with coming into our clinic daily to take his medications on site every day. And then he began taking a weekly pill pack with him and finally began filling the pill pack himself and being able to take it on his own. And he also received housing support. So he actually became like a champion. Started educating other people around diabetes and diet. So he did a wonderful job. He really took on a lot of this learning. But at first, when he came in, he didn't understand anything about diabetes, about what his blood sugar meant or how to take insulin. And so, I mean, this happened over several months' time, but he really learned all of those things. His diabetic wound healed completely, and he got his sugar much more under control than it was. So there we are. We've come to the end. I think we just have about 10 minutes remaining. So happy to have any questions. I can let me stop the share for a minute if that's okay. Then we can see people if folks have questions.
Yeah, thank you so much, Kate. That was really great. I really liked how you covered so many strategies and skill building techniques.
Oh, and
One of the
let me
questions I had
mhm,
was about on the examples of skill building slide, you talked about like self-assessment and decision making
uh-huh.
and mentioned how you sometimes practice decision making scenarios and review those outcomes. I was just wondering if you could maybe provide like more detail or an example of this just to kind of better picture of like what kind of scenarios you've run through with them.
Yeah. So I think a lot of times we do this with folks in particular who are using the emergency room a lot. So if we have people who are going to the emergency room like for everything, typically, we begin with just trying to understand what it is that's making them go to the ER. So, are they afraid of a very poor outcome? Do they not know what else to do? Is there something else that they're kind of getting from the ER visits that is a reason that they're going there? And so, by understanding those things, then we can kind of help people understand themselves, like what's happening. Sometimes it's just completely a misunderstanding, or they just, if they need something in the moment and it's 7 o'clock at night, they can't come to the clinic, and so they go to the emergency room. And so, beginning with kind of some of that understanding, we then might go into some scenarios with the person to say, like, hey, here's what happened last time. Like, you lost your medication, excuse me. And so, in the moment, you decided to go to the emergency room to get it replaced. But what if, then we would talk through, like, if you missed a single dose of this medication, kind of helping them to understand what their medications are. Is this life-threatening if you miss a single dose of this? And then also letting them know, kind of making sure they have the information. They can call the health center, call the on-call number, or come in as a walk-in in the morning. And so based on whatever that scenario is, we then could kind of talk them through like, okay, what if this happened again? And you were missing your metformin, which is a diabetes medication. You got it, it was lost and you missed it for one night. What could you do? And so we could encourage them to like check your blood sugar and make sure that it's not very high. And if it's not, you can call us in the morning and we can help you figure this out right away. Sometimes it helps to also talk through with the person, like what some of the advantages to doing that might be. Like we can take care of this for you quickly. You can come into the clinic. We can give you like a quick short-term supply of this medication, and you don't have to sit in the emergency room for hours. You don't have to lose your bed at the shelter because you're in the ER for so long. Like there's a lot of positives around accessing the clinic differently. And so I guess that's an example I see a lot, like so many folks who are just always in the emergency room. Um, and part of it is people don't feel empowered around their health, around make those assessment skills or knowing like, is this okay? Or am I in danger? And so a lot of it is kind of talking through with them, what is an emergency? Because we do always want people to go in an emergency. And so also reinforcing with them, like if you're having trouble breathing, if you're having chest pain, if you're feeling, any of these ways that are concerning, of course we want you to go. And if you, are just concerned because your glucometer stopped working, it's okay to come to us at the clinic the next day. And that can take time, but I do find that people use the emergency room less and less, especially when they realize the resources that are available to them at the clinic. And if the clinic is responsive to their needs, they're much more likely to just come in, to us to get some support, and they can quickly do it as a walk-in and see the nurse or see the CHW and kind of address almost everything